If you are over 60 years old and suffer from constipation, gas, or constant bloating, you are not alone in this struggle. My name is Dr. Harold Whitman, and I have been practicing gastroenterology for over 25 years. Today, I want to share with you a remarkable discovery that has transformed the lives of countless patients in my practice. We are going to discuss one simple food that can revolutionize your digestive health in just a matter of days, backed by solid scientific evidence. Before we dive into this solution, let me paint a picture of what many people over 60 experience daily. You wake up feeling heavy and uncomfortable. Your abdomen feels distended, as if you have swallowed a balloon. You struggle to have regular bowel movements, sometimes going 3 or 4 days between visits to the bathroom. Gas builds up throughout the day, causing embarrassing moments and physical discomfort. You have tried over-the-counter medications, changed your diet multiple times, and perhaps even consulted other doctors, but nothing seems to provide lasting relief. This scenario is far more common than most people realize, and it represents what I call the silent epidemic affecting our aging population. The statistics are truly staggering when you examine them closely. 1 out of every 3 people over the age of 60 suffers from chronic constipation. This is not just an inconvenience or a minor health issue. Chronic digestive problems can lead to serious complications, including hemorrhoids, anal fissures, fecal impaction, and in severe cases, bowel obstruction. But what causes this epidemic of digestive distress among older adults? The answer lies in understanding how our digestive system changes as we age. First and foremost, our intestinal motility begins to slow down significantly. The muscles that line our digestive tract, which are responsible for moving food and waste through our system, become weaker and less coordinated over time. This natural aging process means that food moves more slowly through our intestines, allowing more water to be absorbed and leaving stools harder and more difficult to pass. Dehydration plays a crucial role in this process as well. As we age, our sense of thirst diminishes, and many older adults simply do not drink enough water throughout the day. Additionally, the kidneys become less efficient at conserving water, which compounds the problem. When our bodies are dehydrated, the colon absorbs even more water from the stool, making it increasingly difficult to pass. Our dietary habits often change dramatically as we get older, and not always for the better. Many seniors find themselves eating less fiber-rich foods due to dental problems, difficulty chewing tough vegetables, or simply out of convenience. Processed foods, which are often easier to prepare and consume, become a larger part of the diet, but these foods are typically low in fiber and high in ingredients that can slow digestion. Medications present another significant challenge for older adults. Many common medications prescribed to seniors, including pain medications, antidepressants, iron supplements, calcium channel blockers, and diuretics, can cause constipation as a side effect. When you are taking multiple medications, as many seniors do, these effects can compound and create severe digestive problems. Stress and anxiety also play important roles in digestive health. Many older adults face significant life changes such as retirement, loss of loved ones, health concerns, or changes in living situations. Chronic stress directly affects the digestive system by altering gut motility and changing the balance of beneficial bacteria in our intestines. Now, after explaining all these challenges, you might be wondering if there is any hope for improvement. The answer is absolutely yes, and the solution might surprise you with its simplicity. The food I am talking about is chia seeds. These tiny black seeds, which have been consumed for thousands of years by ancient civilizations, are making a remarkable comeback in modern medicine for their incredible digestive benefits. Chia seeds are truly a nutritional powerhouse, particularly when it comes to digestive health. Let me explain exactly why these small seeds can make such a dramatic difference in your digestive comfort and regularity. The key lies in their unique composition and the way they behave when they come into contact with liquid. When chia seeds are mixed with water, they undergo a fascinating transformation. Within just 15 minutes, these tiny seeds can absorb up to 10 times their weight in liquid, forming a gel-like substance around each seed. This gel formation is crucial to their digestive benefits. The gel acts as a gentle, natural lubricant as it moves through your digestive system, helping to soften stool and make it easier to pass. The fiber content in chia seeds is nothing short of remarkable. Just 2 tablespoons of chia seeds contain approximately 10 grams of fiber, which represents about 40% of the daily recommended intake for adults. This fiber is a perfect combination of soluble and insoluble fiber, each serving important functions in digestive health. The soluble fiber in chia seeds dissolves in water to form that beneficial gel I mentioned earlier. This gel slows down digestion in a positive way, helping to regulate blood sugar levels and providing a feeling of fullness that can help with weight management. More importantly, for our digestive concerns, this gel helps to sweep through the colon, gathering waste and toxins as it moves along. The insoluble fiber in chia seeds adds bulk to the stool and helps speed up the passage of food through the digestive tract. This type of fiber acts like a natural broom, helping to clean the walls of your intestines as waste moves through your system. The combination of both types of fiber creates an optimal environment for healthy, regular bowel movements. But the benefits of chia seeds extend far beyond their fiber content. These remarkable seeds are rich in omega-3 fatty acids, which play a crucial role in reducing inflammation throughout the body, including in the gut lining. Chronic inflammation in the digestive tract can contribute to many digestive problems, so the anti-inflammatory properties of chia seeds help create a healthier environment for digestion. Chia seeds also act as a prebiotic, meaning they provide food for the beneficial bacteria in your gut. A healthy balance of gut bacteria is essential for proper digestion, immune function, and overall health. By supporting the growth of good bacteria, chia seeds help restore balance to your digestive system from the inside out. The mineral content of chia seeds is also impressive and relevant to digestive health. They are rich in magnesium, which helps relax the muscles in your digestive tract and can help prevent cramping and spasms. They also contain calcium, phosphorus, and potassium, all of which support overall digestive function. Now, let me share with you the most effective way to use chia seeds for digestive relief. The method I recommend to my patients is both simple and highly effective. Take 1 tablespoon of chia seeds and add them to a glass of warm water. The warm water helps speed up the gel formation process. Let this mixture sit for 15 minutes, stirring occasionally. During this time, you will notice the seeds beginning to swell and the water taking on a slightly thicker consistency. Drink this mixture first thing in the morning on an empty stomach. This timing is important because it allows the chia seed gel to begin working immediately without interference from other foods. After drinking the chia seed mixture, follow it with another full glass of plain water. This additional water is crucial because it helps the fiber in the chia seeds work effectively and prevents any possibility of the seeds absorbing too much water from your digestive tract. If you prefer, you can incorporate chia seeds into other foods as well. They work wonderfully in overnight oats, where they have plenty of time to absorb liquid and create that beneficial gel texture. You can also add them to smoothies, yogurt, or even sprinkle them on salads. However, for maximum digestive benefit, I recommend the morning water method as your primary approach. For additional digestive support, consider adding a pinch of cinnamon to your chia seed drink. Cinnamon not only improves the taste, but also helps regulate blood sugar levels and has mild antimicrobial properties that can support gut health. While incorporating chia seeds into your routine, it is equally important to avoid foods that can slow down digestion and counteract the benefits you are trying to achieve. Bananas, while nutritious in many ways, can be binding for some people and may worsen constipation. White bread and other refined grains lack fiber and can contribute to sluggish digestion. Cheese and other high-fat dairy products can also slow digestion for many people, particularly as we age, and may develop lactose sensitivity. Let me share a real-life example from my practice that perfectly illustrates the power of this simple solution. Emma, a 70-year-old retired teacher, came to my office after suffering from chronic bloating and irregular bowel movements for over 3 years. She had tried numerous over-the-counter remedies, prescription medications, and dietary changes, but nothing provided lasting relief. Her quality of life was significantly impacted, and she had become reluctant to engage in social activities due to her discomfort and unpredictable digestive symptoms. After our consultation, I recommended that Emma try the chia seed protocol I have outlined for you today. She was skeptical at first, wondering how something so simple could help when nothing else had worked. However, she was willing to try anything at that point. Emma began drinking 1 tablespoon of chia seeds in warm water every morning, followed by an additional glass of plain water. The results were nothing short of remarkable. Within just 3 days, Emma reported a significant reduction in bloating. By the end of the first week, she was having daily bowel movements for the first time in years. After 2 weeks, she told me she felt like a completely different person. Her energy levels improved, her mood brightened, and she was able to return to the activities she loved without worrying about digestive discomfort. Emma's story is not unique. I have seen similar transformations in dozens of patients who have implemented this simple protocol. The key is consistency and patience. While some people notice improvements within days, others may take a week or two to experience the full benefits. It is important to start slowly when introducing chia seeds to your diet. Begin with 1 tablespoon per day and gradually increase if needed. Some people may experience mild digestive adjustments as their system adapts to the increased fiber intake. This is normal and typically resolves within a few days. You do not need to live with digestive discomfort and irregularity. Sometimes the most powerful solutions come in the smallest packages. Chia seeds represent a return to natural, gentle healing that works with your body rather than against it. Unlike harsh laxatives that can create dependency and disrupt your natural digestive rhythms, chia seeds support and restore healthy function. The beauty of this approach lies in its simplicity and safety. Chia seeds are a whole food with no artificial additives or chemicals. They provide sustained relief rather than quick fixes that often come with unpleasant side effects. By addressing the root causes of digestive problems rather than just masking symptoms, chia seeds offer a path to long-term digestive health and comfort. Remember, small changes can have profound impacts on your health and quality of life. Give chia seeds a chance to transform your digestive health, just as they have for so many of my patients and countless others around the world.